Do you always feel tired? Even after waking up in the morning, does your body feels heavy? Do you get breathless while walking or during work and think maybe it's stress or I didn't sleep enough? But think again, this is not stress, this is anemia. According to WHO, nearly 2 billion people worldwide suffer from anemia, which means that 1 out of every 4 people, their blood is not delivering oxygen properly to the body. This is not just fatigue, this is a silent epidemic. And the sad part is that the most people don't even know they have it. Watch till the end because today I will explain how this simple deficiency affects your energy, immunity, and the heart, and how just changing your food choices can bring new strength into your life. The enemy you cannot see. We assume that if we are young, we go to the gym and eat a balanced diet, then we are fine. But the reality is that most young adults today have low oxygen delivery in their blood and they don't even realize it. Anemia means that the healthy red blood cells called RBCs in your blood have decreased, or the hemoglobin inside them, which carries oxygen from the lungs to the whole body, has dropped so much that the body slowly enters oxygen starvation, meaning your cells are not getting the fuel that keeps them alive. The World Health Organization says anemia is one of the most common and least diagnosed conditions globally. New mothers, students, office workers all complain, I have no energy and I cannot concentrate. But when a blood test is done, it turns out that hemoglobin is dangerously low. This is the story of Susan, a 29-year-old working woman. Office in the morning, home in the evening, exhaustion at night. She thought it was just stress. One day, while traveling on the metro, she suddenly felt dizzy. Darkness covered her eyes, got dizzy. At the hospital, tests were done. Hemoglobin was 7.4. The doctor said, your body isn't receiving oxygen. You are running on survival mode. Your car is running without an engine oil. She was alive, but inside her body was undergoing an oxygen crisis. In easy words, every cell in your body needs oxygen to stay alive. Your red blood cells deliver this oxygen. Inside these RBCs is a protein called hemoglobin. When iron is low, hemoglobin does not form. When hemoglobin is low, oxygen supply drops. And when the oxygen is low, every organ of the body goes into a low battery mode. This is why anemia symptoms include constant fatigue, shortness of breath, dizziness, or heavy head, pale lips or nails, hair falling, dry skin, and mental fog. All of these are signs that your oxygen delivery system is failing. So why young people don't take it seriously? But when tiredness becomes routine, it's not normal, it's a disease. According to Harvard Health, chronic fatigue in young adults is most often linked to undiagnosed anemia or iron deficiency. We drink energy drink, increase our coffee intake, but the nutrients our body actually needs, which is iron, folate, and vitamin B12, we remove that from our diet. Modern lifestyle is iron deficiency factory. We eat polished rice, white bread, and processed snacks and think, I am eating clean. But these foods are empty calories with almost no iron, vitamins, or minerals. Fast food and caffeine reduce iron absorption in the blood. The stress hormone cortisol weakens the stomach, reducing nutrients absorption, meaning you are eating food, but your body is not receiving nutrition. Now, hidden dangers of coffee, tea, and energy drinks. We think coffee gives energy, but coffee and strong tea blocks iron absorption. 1 cup of coffee can reduce iron absorption from food by up to 60%, which is a Lancet Nutrition study of 2022. Energy drinks and soft drinks flush out body minerals. Result fatigue plus pale skin plus weak immunity. The irony is we drink coffee for energy, but same coffee steals our real energy. Double risk for women. The problem is twice as common in women. Reasons: blood loss during menstruation, pregnancy and breastfeeding, transferring nutrients to the baby, and the pressure to stay slim leads to cutting nutritious food. According to WHO, 52% of South Asian women have iron deficiency anemia, meaning every second woman is living with low oxygen, believes it's a normal weakness. Long-term dangers: this is not just an energy problem. Anemia can affect the brain and the heart. Low oxygen slows down brain cells, weakens memory and focus. When the heart receives less oxygen, it works harder, leading to heart enlargement and even heart failure. Harvard Medical Research states chronic anemia increases the risk of heart attack by 41% in young adults. A simple nutritional deficiency can turn you into a lifelong cardiac patient. The silent epidemic. More than 2 billion worldwide are iron deficient, and over 1 billion of them are in South Asia. But the tragedy is people know their phone models, but they do not know their hemoglobin level. We get blood tests only when things are very bad, and then the doctor says your hemoglobin is only 7, meaning your oxygen transport system is running below half capacity. You are alive, but your body is in survival mode. Anemia, the hidden fatigue epidemic. Anemia never appears suddenly. The body gives warning beforehand, but we label these as stress or lack of sleep. If your nails are turning white, your lips are pale, your heartbeat is unusually fast, or you feel breathless while climbing stairs, these are signals that your oxygen transport is reduced. According to John Hopkins study of 2023, 60% of patients ignored months of fatigue, dizziness, and loss of appetite. Result, their hemoglobin dropped to dangerous levels. A simple test that can save your life. Just one CBC called complete blood test count can show how serious the problem is. The main things measured are hemoglobin level below 12 gram per deciliter is a dangerous sign, MCV, which is mean cell volume or corpuscle volume. Small RBCs indicate iron deficiency, and serum ferritin, the most accurate measure of iron storage. But unfortunately, in our countries, people consider blood tests a luxury. We spend thousands on cosmetics but avoid a simple blood test. Natural treatment. Your kitchen is your hospital. Now let's talk about treatment. Iron supplements help, but the real cure is food. Iron-rich foods, spinach, mustard greens, liver, lentils, pomegranate, dates, apples, dry fruits, raisins, almonds, and walnuts. Vitamin C food like lemon, orange increases absorption. Remember, taking vitamin C with iron increases absorption 3 times. Harvard Nutrition reports 2022, but coffee, tea, and cola reduces absorption by 60%, meaning tea right after lunch is zero absorption. Now, there are several myths about the iron deficiency anemia. Myth number 1, iron tablets upset the stomach. Fact, it happens only on an empty stomach. Always take iron right after food or just with orange juice. Number 2, I take a daily vitamin. I can't have anemia. Fact, multivitamins contain very little iron. Number 3, diet alone will fix it. Fact, in moderate to severe anemia, supplements are necessary. Women with menstrual blood loss, pregnant women, vegetarians, non-heme iron absorbs less. Teenagers, high demand during growth, frequent blood donors. Gastric patients, poor absorptions. WHO says countries with grain-based diet have twice the anemia rate. Now, connection between anemia and mental health. Iron is not just for the blood, it fuels the brain. When hemoglobin is low, the brain gets less oxygen. Result, poor memory, increased mental stress, depression, and anxiety symptoms. Cambridge Brain Health Study 2023 states iron deficiency shrinks the hippocampus, affecting memory and focus, meaning iron deficiency can physically shrink your brain. Anemia during pregnancy. During pregnancy, the body's demand doubles. If the mother is iron deficient, the baby gets less oxygen, leading to low birth weight, premature delivery, and increased postpartum depression. WHO guidelines, every pregnant woman must take 30 to 60 milligram of iron and 400 microgram of folic acid daily. But many women visit the doctors only when their hemoglobin has already dropped below 8. Social myths, low blood, just eat beetroot. Beetroot helps, but it's not a cure. Balanced diet is necessary. Weakness happens only in women. Men also lose iron due to workouts and gastric issues. Fatigue is normal, happens to everyone. No, daily fatigue is a sign your blood is not carrying oxygen. Prevention plans. This is important, so listen to the end. Week number 1, get a CBC test. Check hemoglobin and ferritin. Week number 2 to 4, add iron-rich foods. Don't drink tea after meals. Week number 5 to 8, if hemoglobin is less than 12, start supplementation after doctor's advice. Daily take vitamin C, stay hydrated, fix sleep cycle. Quarterly repeat tests. Anemia is reversible, but follow-up is essential. If this video helps you, don't just like, share it. Maybe someone you know is anemic and does not even realize it. Comment, I will check my hemoglobin today. Health is not a luxury, it's a responsibility. Remember, real energy comes from healthy food, not energy drinks. You're watching Dr. Raza Health 360 MD. Your better health is my mission. Stay tuned for more. Till next time. My name is Dr. Raza. I'm a practicing family physician in USA for the past 18 years. I'm an American board-certified physician and diplomate of American Board of Family Medicine.